Hi gang, Dr. Charles Bradley here at Domino Veterinary Hospital. It is Friday, so it's Facebook Live time. Thanks for joining us. We're going to be talking about cats today. And specifically, we're talking about pain in cats. And there's several things that can cause pain in cats. And there's a lot of different approaches. Cats are a little bit tricky, a little bit problematic in terms of pain management. But we're going to talk about some of the strategies that are out there. And I'll try to speak a little bit about my experience. As you know, I used to be 100% feline, and I did that for many years before starting. So we do have a special interest in cats here at Domino. In fact, we have a little kitty right now that we're taking care of, and managing their well-being is very important to them doing well. They have to feel good so that they can progress, and we're going to talk about some of the causes of pain. So one of the most underdiagnosed causes of pain is an older or elder kitty who has degenerative joint disease or arthritis. And one of the places that I've seen it is in the elbows. It's amazing when you take x-rays of cats, say 12 or older, how many cats have really, really creaky elbows. So if you've got an elder cat, or you know somebody who has a kitty who's, say, a senior, and I would say maybe 8 years plus, and after say 13, I would call those geriatrics. Please ask the owners to check the elbows. Just flex the elbow back and forth like the 90 degrees, make sure we can open up that elbow. And when you feel the elbow, if it's crackly or grinding as things go along as you do your exam, or if the cat resists the examination, then that's a clue that there might be some problems. We also get the same thing in the hip joint. So that's a really, really common cause of pain in elder cats. Now, probably the number one cause of pain, and I'm saying number one, is tooth resorption. This is just an absolute scourge of cats. I always worry that I'm going to check a cat and find that there's tooth resorption. It's one of the most painful things that a cat can have. It's so painful that when we check these cats under anesthesia, when we're trying to clean up their teeth, we can put a dental probe and we'll see the jaw chattering even under anesthesia. It's a really, really sad thing. It's called tooth resorption. If your veterinarian ever says, you know, we need to take a look at these teeth, we need to anesthetize kitty and examine, say yes. It's just amazing. Just anecdotally, in our last few months here at Domino, we've had a few cats that were a little edgy, a little bit off, and the very afternoon of the procedure, after we took out these painful teeth, they were just really nice and they were very affectionate, and it's almost like a weight had been lifted off their shoulders. So we call that tooth resorption. They've also been called dental cavities. They've been called odontoclastic resorptive lesions or neck lesions. So if you hear any of that terminology, be aware of it. And if you want to check your own cat, all you have to do is pull the lips back and see if you can locate any pinpoint red spots on the teeth. Or if you want to take a little Q-tip and just kind of check the mouth and see if there's any local or focal sensitivity. That's a really big one. Number one cause of cat pain, in my opinion. Now, the other one that we underdiagnose, I think, is the cat with cancer. Cancer is very debilitating, and it drives pain sensation in the brain at a biochemical level. So we cannot discount cancer as a source of pain, especially bone cancer. Of course, postoperative pain is a conversation that we always have here, and we'll get into how to deal with that in a few moments here. Another greatly painful situation or diagnosis that I see all the time is something called pancreatitis. People say, well, what is pancreatitis? So anytime you hear itis at the end of a medical word, it means that it's inflamed. So the pancreatitis, the pancreas is not happy, it's inflamed, it's an itis. Now, part of inflammation is swelling and pain. So when you feel these kitties behind the rib cage, they're very painful, and that can cause a lot of poor doing and a lot of just malaise in a cat. And we'll talk about recognizing pain in cats in a moment. Another exquisitely painful thing that I've seen before is a kitty that has, it seems like a paralysis, but it's actually a blood clot as the aorta comes down and splits off into the back legs. That's called thromboembolic disease, and there's like a blood clot. And if there's no blood, the legs become very, very sensitive and painful, and that can be a manifestation of cardiovascular disease. The most common in cats is called HCM, or hypertrophic cardiomyopathy. So if your cat's legs are painful, or if the foot pads are cold, that's an immediate medical emergency, and you need to have veterinary care immediately. Call the doctor or call the emergency room immediately. Also on the list, of course, for pain would be trauma. Hit by car, we don't get that so much anymore, but any form of trauma. When I was in Montreal, we had 2 different cats with high-rise syndrome. They fell off the 20th story, and they actually both lived, but that's a painful experience, so we would manage that pain. And I want to talk about, how does a cat manifest pain? It's almost impossible to know that a cat's in pain. They are the great masqueraders. They can just camouflage pain, and generally it's manifested as hiding behavior. It's withdrawing into a shell. If you can find the local spot of pain, you might be able to touch some of the areas we've talked about, the joints, the teeth, maybe the belly, the back. It's very hard to understand. So if your cat is not acting right, that's basically the bottom line. If your cat is not doing the normal route, he's painful, unless proven otherwise. And I think that that's why veterinary visits are very important, so doctors can evaluate a cat. And one of the problems we're having in veterinary medicine is that the number of cats going to see the vet is way down. Sometimes it takes a veterinary professional to understand whether a cat is in pain or not. So any kind of behavioral changes, think pain. Let's talk a little bit to finish up here about how do we manage pain. Well, one of the problems with cats is that they are cats, and they have a special way to metabolize medications. So their liver is not as good at metabolizing medications as, say, a person or a dog. So I want you to be very, very careful. Just parenthetically, you can't give human medications to a cat. You can't give a little bit of aspirin. You cannot give a little bit of acetaminophen. You have to have a specific cat-friendly medication. So let's talk about the different ways that I approach pain. The number one way that I approach pain is with a category of drugs called opiates. Opiates are a category of drugs. They're in the news. We often reach to those. There's some very specific ones that are available for cats, and they can do extremely well. The words that you will hear mentioned are buprenorphine, butorphanol, tramadol. So you will probably hear those words if you have a cat that has had surgery or dental procedures and the like, and sometimes palliative measures also involve opiates. Now, there's a category of pain meds that I don't like in cats. I have a mortal fear of them. They're NSAIDs, non-steroidal anti-inflammatory drugs. NSAIDs, N-S-A-I-D-S. And the most prevalent one right now is Onsior. I do not like to reach for NSAIDs because they have a reputation, and a well-earned reputation of causing disease in cats. So you have to be really, really careful. It doesn't mean that you won't use it, but NSAIDs are very problematic, and you have to be 100% sure that a cat's kidney and liver function are good when you use the NSAID category. Some of the words that you might hear in that category, as I mentioned, Onsior, and another one, Metacam. But we have to be very careful. Some veterinarians are more liberal with that than I am. I guess I'm old school, and I try to stay away from them. I'll actually use corticosteroids in pain management. We talked about the elder cat that has DJD, or degenerative joint disease, also call that arthritis. Sometimes a little bit of selective use of steroids can help with pain management. Pain management is very tricky in the elder cat because so many of the drugs that we use are not appropriate for a patient that's older or has kidney or liver disease. Another one that we're working with more and more is a medication called gabapentin. It's actually an anticonvulsant drug, and that can be titrated to a appropriate dose for pain management. And parenthetically, we are using gabapentin in cats to take away the stress of going to the veterinary office. And we have a few candidates. I can think of one. His name is Jovi, and he always benefits from having his gabapentin before he comes to visit. We can also use a local anesthetic called lidocaine situationally. Obviously, you'd have to be working with a veterinarian to be able to use that. And we have had a few cats where we've used tricyclic antidepressants. The most common one is amitriptyline. So you might hear that word used situationally, and it's also translates into the world of behavior, veterinary behavior. We have a new drug called Cerenia, which is a really magical drug that can be very good for pain management in the short term. So we've talked about a lot of drugs. You can see it's a real fine tuning when it comes to cats. There's nothing really that I can tell you, hey, just go to the pharmacy and get such and such a medication. It's just not that kind of a thing with cats. Cats are not a very well studied species, so there's a lot of risk involved. Risk reward is always what it's all about, but please recognize as a take home, cats can have pain. They very, very often have pain, very underdiagnosed. The most common cause of pain that I see is oral pain, and I would say degenerative joint disease and arthritis. So that's what we've got for today from Domino. Do you have any questions that have come in, Kelsey?
No questions. No
questions. We do encourage questions. You can contact us on the phone at 978-610-6870, 978-610-6870. Dr. Bradley, myself can answer. I have a good team of technical helpers. Dr. Cruz, of course, she's my colleague, and if you have pocket pet concerns or rabbit concerns, we can help you through her wonderful services. And for now, it's Facebook Live. Thank you very much for joining us from Domino Vet. Have a good day. Thank you.